Nurse Aide Test Prep Guide download. Question 1. What is the proper ratio of bleach to water for disinfecting surfaces? Option A, 1:1. Option B, 1:10. Option C, 1:100. Option D, 10:1. The correct answer is option B, 1:10. A 1:10 dilution, 1 part bleach to 9 parts water, is the standard for disinfecting surfaces contaminated with blood or body fluids. 1:100 is for general disinfection, not blood/body fluid spills. Question 2. To prevent skin breakdown, the nurse aide should: Option A, keep the skin clean and dry. Option B, keep the skin moist with lotion. Option C, rub bony prominences vigorously. Option D, use only powder on the skin. The correct answer is option A, keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 3. When providing care for a client from a different culture, the nurse aide should: Option A, follow standard procedures regardless of culture. Option B, ask the client about their preferences and respect them. Option C, assume cultural preferences based on the client's appearance. Option D, ask the nurse to provide care instead. The correct answer is option B, ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 4. A client has difficulty adjusting to a new facility. The nurse aide should: Option A, tell the client they will adjust. Option B, allow the client to express their feelings. Option C, leave the client alone to adjust. Option D, call the family immediately. The correct answer is option B, allow the client to express their feelings. Allowing expression of feelings helps the client process the transition. Telling them they will adjust, A, is dismissive. Leaving them alone, C, may increase isolation. Calling the family, D, may be appropriate but not the first step. Question 5. A client with mental health issues is refusing medication. The nurse aide should: Option A, force the client to take the medication. Option B, report the refusal to the nurse. Option C, hide the medication in food. Option D, tell the client they will get worse. The correct answer is option B, report the refusal to the nurse. Medication refusal should be reported to the nurse. Forcing, A, or hiding medication, C, is unethical and illegal. Threatening, D, is not therapeutic. Question 6. A client is angry and yelling. The nurse aide should: Option A, yell back at the client. Option B, leave the room and return later. Option C, listen to the client's concerns and remain calm. Option D, call security. The correct answer is option C, listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others. Question 7. A client becomes upset and tearful while discussing their recent diagnosis. The nurse aide should: Option A, change the subject to something more positive. Option B, tell the client to stop crying. Option C, sit with the client and allow them to express their feelings. Option D, leave the room to give the client privacy. The correct answer is option C, sit with the client and allow them to express their feelings. Allowing the client to express emotions and providing a supportive presence validates their feelings and helps them process difficult information. Changing the subject dismisses their feelings. Telling them to stop crying is insensitive. Question 8. What should the nurse aide do first for a client who has fallen? Option A, move the client to their bed. Option B, assess for injury and call for help. Option C, document the fall. Option D, call the client's family. The correct answer is option B. Assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 9. The pulse site most commonly used for adults is the option A, brachial artery, option B, radial artery, option C, carotid artery, option D, femoral artery. The correct answer is option B, radial artery. The radial artery at the wrist is the most commonly used pulse site because it is easily accessible and does not disturb the patient significantly. The brachial is used for blood pressure and infants. The carotid is used in emergencies. The femoral is rarely used for routine assessments. Question 10. A client with Alzheimer's disease gets upset because they cannot find their deceased spouse. The nurse aide should: option A, remind the client that their spouse is dead. Option B, gently redirect the conversation to a pleasant memory of the spouse. Option C, tell the client to stop worrying. Option D, call the nurse to explain the situation. The correct answer is option B. Gently redirect the conversation to a pleasant memory of the spouse. Redirecting to a pleasant memory validates the client's feelings while avoiding the distressing reality. Reminding them the spouse is dead may cause repeated grief. Dismissing their worry doesn't address the emotion. Question 11. When using a manual blood pressure cuff, the nurse aide should inflate the cuff. Option A, to 100 mmHg. Option B, to 150 mmHg. Option C, to 180 mmHg. Option D, 30 mmHg above the estimated systolic pressure. The correct answer is option D, 30 mmHg above the estimated systolic pressure. The cuff should be inflated approximately 30 mmHg above the estimated systolic pressure, determined by palpating the radial pulse while inflating. This ensures adequate occlusion. Fixed numbers don't account for individual variations and could be insufficient or excessive. Question 12. When communicating with a client with dementia, the nurse aide should: option A, use complex medical terms. Option B, use simple, one-step directions. Option C, speak loudly. Option D, ask open-ended questions. The correct answer is option B. Use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 13. What does it mean when a client is placed on droplet precautions? Option A. The client must be in a negative pressure room. Option B. The nurse aide must wear an N95 respirator. Option C. The nurse aide must wear a surgical mask within 3 feet of the client. Option D. The client cannot leave the room. The correct answer is option C. The nurse aide must wear a surgical mask within 3 feet of the client. Droplet precautions are used for infections spread by respiratory droplets. These droplets travel up to 3 feet, so a mask is required within that distance. Negative pressure and N95 are for airborne precautions. Question 14. The nurse aide should speak to a client who is hearing impaired by: option A, speaking very loudly. Option B, speaking slowly and clearly while facing the client. Option C, writing everything down. Option D, asking a family member to translate. The correct answer is option B, speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 15. Which of the following can cause an inaccurate pulse oximetry reading? Option A, nail polish. Option B, client holding their breath. Option C, client sleeping. Option D, client sitting up. The correct answer is option A, nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 16. When should a nursing assistant perform hand hygiene? Option A. Before touching a client. Option B. After removing gloves. Option C. After touching client surroundings. Option D. All of the above. The correct answer is option D. All of the above. The CDC's 5 moments for hand hygiene include before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 17. A client with a catheter should have perineal care performed. Option A. Daily during the bath. Option B. At least once a shift. Option C. Only if soiled. Option D. Twice per shift. The correct answer is option B. At least once a shift. Clients with indwelling catheters need perineal care at least once per shift to prevent catheter-associated urinary tract infections, CAUTI. Daily is insufficient. Infection can develop within hours. Question 18. Normal adult resting heart rate range is: Option A. 40 to 60 beats per minute. Option B. 60 to 100 beats per minute. Option C. 80 to 120 beats per minute. Option D. 100 to 140 beats per minute. The correct answer is option B. 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 19. Which statement demonstrates therapeutic communication? Option A. You should not feel that way. Option B. Everything will be fine. Option C. Tell me more about what happened. Option D. I know exactly how you feel. The correct answer is option C. Tell me more about what happened. Tell me more is an open-ended question that encourages expression, demonstrating therapeutic communication. You should not feel that way is judgmental. Everything will be fine is false reassurance. I know exactly how you feel assumes identical experience. Question 20. When receiving a report at shift change, the nurse aide should: Option A. Ask questions about unclear information. Option B. Write down everything quickly and leave. Option C. Ignore information about client preferences. Option D. Rely on the previous aide's verbal report only. The correct answer is option A. Ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details. Question 21. A client who is withdrawn and refuses to speak to anyone is likely experiencing: Option A. Depression. Option B. Anger. Option C. Excitement. Option D. Anxiety. The correct answer is option A. Depression. Withdrawal and refusal to communicate are common signs of depression in the elderly and chronically ill. While anxiety and anger may include withdrawal with silence more strongly suggests depression. Question 22. Which approach is best when caring for a client with Alzheimer's disease? Option A. Use complex medical terminology. Option B. Use short, simple sentences and give one instruction at a time. Option C. Speak in a loud tone to get the client's attention. Option D. Ask open-ended questions. The correct answer is option B. Use short, simple sentences and give one instruction at a time. Clients with Alzheimer's have difficulty processing complex information. Short, simple sentences with one instruction at a time are most effective. Complex terminology and open-ended questions overwhelm them. Loud tones are perceived as aggressive. Question 23. When assisting a client from lying to sitting position, the nurse aide should: Option A. Have the client sit up quickly. Option B. Sit the client up slowly and allow time for blood pressure to adjust. Option C. Pull the client's arms to sit them up. Option D. Have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 24. When dressing a client with a weak right arm, the nurse aide should: Option A, dress the right arm first. Option B, dress the left arm first. Option C, dress both arms simultaneously. Option D, dress the stronger arm first. The correct answer is option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 25. A client is grieving the loss of their spouse. The nurse aide should: Option A, tell them to move on and focus on their health. Option B, listen and acknowledge their loss. Option C, avoid mentioning the spouse to prevent sadness. Option D, suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated.